Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I've reviewed your recent episode and your medical records. Can you describe what happened during this episode when you found yourself 75 miles away from home?
Yes, doctor. It was very unsettling. I just got into my car, and the next thing I knew, I was at this gas station far from home. I don't even remember why I started driving or where I intended to go. The last thing I remember was feeling numb in my legs and very confused.
Had you experienced anything like this before?
Well, there have been a few times where I've found myself in places and couldn't remember why I went there, but it was never this far from home. My legs often go numb if I sit too long, and I've been having more trouble with cramps and pain in my legs and ankles lately.
How often do these episodes of numbness and cramps occur, and how do they affect your daily activities?
They happen quite frequently. The cramps can be very painful, and the numbness sometimes makes it hard for me to walk or drive. I've been using a cane to help with my balance, which has been off too. It's all making me feel very dependent, which I hate.
You mentioned memory lapses and confusion as well. Can you elaborate on that?
Yes, besides these episodes of disorientation, I've been forgetting things more. Simple things like where I put my keys, or if I've taken my aspirin. My family is worried about my memory, too.
I see. And how has your vision and your recent surgical history on the knee impacted your mobility and overall health?
My vision in one eye is quite poor after the procedure I had, and losing my kneecap and not having it replaced has made walking and standing a challenge. I feel like all these things are connected, but I'm not sure how.
It sounds like these issues are significantly impacting your quality of life. Let's review some of the findings from today's evaluations and discuss the next steps. Your blood pressure and heart rate are stable, though your heart rhythm is irregular, which is expected with your history of atrial fibrillation. Your neurological exam shows good cognitive function, but there's a noticeable weakness in your lower extremities, and your reflexes are diminished. This might be contributing to your mobility issues.
That makes sense. I just want to understand what's happening and make sure I'm doing everything I can to manage these problems.
Absolutely. Let's go over the clinical findings in detail. Your blood glucose level is within normal limits, which is good. The echo shows mild left ventricular hypertrophy, and your ejection fraction is at 55%, which is within a normal range but on the lower end, likely due to your chronic atrial fibrillation. The head CT didn't show any acute issues like a stroke, but there is evidence of mild cerebral atrophy, which could be contributing to your memory issues.
Is that something that gets worse? The thought of losing my memory scares me.
Cerebral atrophy can progress, but there are ways to manage the symptoms and possibly slow the progression. We'll need to closely monitor this. Given your atrial fibrillation and the risk factors, it's also crucial we manage your stroke risk effectively. Not being on an anticoagulant like Coumadin is a concern given your condition.
I've been worried about the bleeding risks I heard about. That's why I haven't started it.
It's important to balance the risks and benefits. We can consider newer anticoagulants that have a lower risk of bleeding. For your mobility and leg issues, physical therapy could be very beneficial. It can help strengthen your legs and improve your balance.
What are the next steps then?
Here's the plan. I'm going to refer you to a neurologist to further evaluate your memory and cognitive issues. We'll also have a cardiology follow-up to discuss the best anticoagulant options for you. I want to start you on a physical therapy program to address your leg strength and balance. Lastly, we'll ensure you have a medical alert system set up at home given your episodes of disorientation.
Thank you, Doctor. I appreciate your help. It's a lot to take in, but I'm glad we're figuring this out.
You're welcome. It's important to address each of these issues comprehensively. I'll arrange for the referrals and follow-up appointments. Let's ensure you have all the support you need.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. I'm here because the wart on my hand has come back. I had it frozen off before, but it didn't seem to work permanently.
I see. How long ago did you have it treated, and have you tried any other treatments yourself since then?
It was about a year ago when it was last treated with liquid nitrogen. I've tried some over-the-counter remedies since then, like salicylic acid patches, but nothing really seems to keep it away for good.
Got it. Thank you for that information. You also mentioned on the phone about an issue with swallowing. Could you elaborate on that for me?
Yes, that's actually been quite bothersome. Sometimes when I eat, especially things like chicken or bread, it feels like the food gets stuck in my throat. It's not painful, just uncomfortable. This has been happening off and on for a couple of years now. The last time I had a real scare with it was 2 years ago when I ended up in the ER.
That does sound concerning. Have you noticed any patterns or specific triggers besides the types of food?
Mostly just dry or tougher foods cause the problem. I've started to be very careful about chewing and even avoiding certain foods.
Understood. Have you noticed any changes or worsening of this condition recently?
Not worsening, but it's definitely not getting better. It's pretty consistent. I don't have pain or anything. It's just really frustrating and a bit scary when it happens.
I appreciate your openness. Let's talk a bit about your other health concerns. How have your headaches and blood pressure been?
My blood pressure is pretty stable now with the medication. I still get headaches occasionally, but they seem to be less in frequency since my blood pressure has been under control.
Good to hear that your blood pressure is stable. Have you had any recent changes to your medication or lifestyle that might be affecting this?
Not really. I've been sticking to the same routine, taking my acid reflux medication and the supplements you know about. I've been trying to eat healthier too.
Excellent. Keeping a stable routine can definitely help manage multiple health issues. Have you had any other new health concerns since we last met?
No new concerns, but I've been thinking about the possibility of sleep apnea because I snore quite a bit and don't always feel rested. But no, nothing new besides that.
It's good you brought that up. We can consider a sleep study to evaluate for sleep apnea, especially if it's affecting your rest. It might also help explain some of the fatigue and headaches.
That would be great. I just want to make sure everything is checked out and managed properly.
Absolutely. That's what we're here for. Now, in terms of your immediate concerns, I recommend referring you to a dermatologist for the wart, and we should also schedule an endoscopy with a gastroenterologist to get a better look at your esophagus and understand the impaction issue.
Sounds like a plan. I'm glad we're getting all this sorted out.
I'll also schedule a follow-up appointment for us to review the results from the specialists and discuss any further steps. In addition, we should look at scheduling your routine screenings, including a colonoscopy for colorectal cancer screening, since it's recommended based on your age and history.
Okay, that sounds thorough. Thanks for helping me keep on top of these things.
Of course, it's important to address all aspects of your health. Lastly, let's update your vaccinations today. The flu shot and tetanus booster are due, and it's best to stay current with those.
All right, let's do that. I appreciate your help with everything today, Doctor.
You're welcome. I'll have my nurse come in to administer the vaccinations, and we'll get all your referrals and follow-up appointments set up before you leave today. If you have any questions in the meantime, don't hesitate to call our office.
Thank you, Doctor. I feel relieved we're addressing everything.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I understand you've been experiencing some challenges since your delivery. Can you tell me a bit more about what's been happening?
Yes, doctor. I've been feeling really overwhelmed and sad most days, and I'm also having a lot of trouble sleeping.
It's not uncommon to experience these feelings after childbirth. It sounds like you might be dealing with postpartum depression. We have several ways to help you manage this, including counseling and medication if necessary.
I'm also worried about breastfeeding. My baby isn't latching well, and it's quite painful.
Let's address one thing at a time. I'll refer you to a lactation consultant for the breastfeeding issues. For your emotional health, how about we start with some counseling sessions? We can also discuss medication options if you're open to that.
That sounds good, doctor. What about the sleep issues? It's really affecting my ability to function during the day.
Sleep disruption is common, but we need to address it to help you recover. I can prescribe something mild to help you sleep better. It's also important to try and maintain a regular sleeping schedule, even if it's difficult with a new baby.
Thank you, doctor. It's reassuring to know there are options. What are the next steps?
I'll set up the referrals and prescriptions we discussed. We'll schedule a follow-up in 2 weeks to reassess your progress. Remember, you're not alone in this. We're here to support you.
Now look at question 26.
Welcome, everyone. Today, we're going to focus on best practices for documenting patient care. Proper documentation is crucial in medical settings, as it ensures continuity of care, legal protection, and accurate billing. Let's start with the basics. Always record the patient's complete medical history and all current symptoms at the beginning of their record. Use clear, concise language and avoid using ambiguous terms that might confuse future caregivers. It's essential to document care immediately after providing it to ensure accuracy and timeliness. Each entry should be dated, timed, and include your initials or signature. Before finishing your shift, review your entries to ensure they are free of errors and fully comprehensive. Lastly, remember that these records are not only a tool for ongoing care, but are also legal documents that can be used in court. They must be thorough, professional, and accurate. Thank you for your commitment to maintaining high standards in patient care documentation.
Now look at question 27.
I've noticed you've been quite stressed during our sessions. Let's discuss some coping strategies that might help. What activities usually help you relax?
I used to enjoy walks and reading, but I've lost interest lately.
It's normal to lose interest in usual activities when you're feeling overwhelmed. However, reintroducing them slowly can be beneficial. Let's start with short, daily walks. It's also effective to pair physical activities with mental relaxation techniques like reading or listening to music.
I haven't really tried combining those activities. Maybe that could help. What about when I'm feeling anxious at work?
For work-related stress, mindfulness techniques can be very helpful. I can teach you a few quick relaxation exercises that you can do even at your desk. Also, setting a regular time to review the day's tasks each morning may help you feel more in control.
That sounds useful. Could you show me one of those exercises now?
Of course. Let's start with a simple breathing exercise. This technique involves deep, slow breaths to help calm the mind and reduce anxiety. I'll guide you through it.
Now look at question 28.
Good afternoon, everyone. Today we are focusing on medical interpreting, a crucial aspect of nursing in our diverse community. Effective communication is essential in healthcare, particularly when we encounter language barriers. It's important to always utilize certified medical interpreters when discussing medical information with non-English speaking patients. We must ensure accuracy and uphold confidentiality, which is often compromised when using family members as interpreters. Consider cultural sensitivities and be aware of nonverbal communication, which can greatly impact how information is perceived. When using an interpreter, remember to speak directly to the patient, not just the interpreter. This helps in building trust and ensures the patient feels respected and involved in their care. Thank you for joining this session, and please make sure to implement these practices in your interactions with patients.
Now look at question 29.
We've scheduled an endoscopy to closely examine your stomach lining, as it's the best way to find the cause of your symptoms. Have you undergone this procedure before?
No, this is my first time. I'm quite anxious about what to expect.
It's perfectly normal to feel anxious. The procedure involves inserting a thin, flexible tube with a camera into your throat to view the upper part of your digestive system. It's quick, generally painless, and very informative. You'll be sedated, so you won't feel or remember much.
How long does the procedure take, and are there any risks involved?
The procedure itself only takes about 20 to 30 minutes. As for risks, they are minimal, but can include reactions to the sedative or minor throat irritation. We take all necessary precautions to minimize any risks.
What should I expect after the procedure? How soon can I eat and drink?
You'll need to rest until the sedative wears off. You might experience some bloating or mild throat discomfort, but these symptoms are temporary. You can start drinking water after a few hours and eat once you feel you're able to swallow comfortably. We'll go over all the post-procedure care before you are discharged.
Now look at question 30.
Today's training session is focused on the crucial steps before and after medical procedures. This guidance is essential for patient safety and for the effectiveness of the procedure. Start by ensuring that all consent forms are properly signed and that patients are correctly prepped, including necessary fasting or specific medication adjustments. Post-procedure, it's vital to monitor patients for any signs of complications, such as infection, bleeding, or unexpected pain. Document all observations thoroughly and promptly communicate any concerns to the attending physician. Educating patients and their families about post-procedure care is also critical. This includes information on medications, activity limitations, signs of complications, and follow-up appointments. Accurate and empathetic communication helps ensure patient compliance and aids in recovery. Thank you for your dedication to these protocols, as they are integral to our commitment to patient care.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning, everyone. Today, I want to delve into a complex and critical issue that intersects the domains of healthcare quality, equity, and clinical practice. Our discussion will be anchored on a recent case study published in the Harvard Medical Journal that addresses racial disparities in the treatment outcomes for myocardial infarction, commonly known as heart attacks. Let's begin by setting the context with some sobering data. Research consistently shows that African American patients are less likely to receive the same standard of cardiac care as their white counterparts. This disparity extends from emergency response times and initial diagnoses to treatments offered and follow-up care. Consider the case of Mr. Thompson, a 50-year-old African American man, documented in our case study. Mr. Thompson presented to the emergency room with classic symptoms of a heart attack: chest pain, sweating, and shortness of breath. Despite these symptoms, the initial response by the attending team was to attribute his pain to less critical causes, which delayed the urgent care needed for myocardial infarction. This delay had severe consequences on Mr. Thompson's health outcomes. The case study explores how subjective interpretations of symptoms and implicit biases can lead to such disparities. Now, let's talk about the systemic issues at play. The research points to several factors contributing to this disparity. One significant factor is the lack of standardized protocols that are strictly adhered to, regardless of the patient's race or ethnicity. Another is the training of healthcare providers that often lacks a strong emphasis on cultural competence and implicit bias recognition. In addressing these issues, the study suggests multiple intervention strategies. First, implementing standardized protocols for treating myocardial infarction that are rigorously followed by all healthcare staff. Second, enhancing the training of medical personnel in the areas of cultural competence and bias recognition. This training should include simulations and role-play scenarios that reflect diverse patient interactions to prepare staff for real-life situations. Additionally, the study advocates for the use of decision support systems in electronic health records that prompt healthcare providers with reminders and checks when treating conditions like myocardial infarction. These systems can serve as an additional layer to ensure all patients receive care that adheres to the highest standards, regardless of any subjective bias a healthcare provider might carry. Lastly, the study underscores the importance of patient-centered communication. It suggests that open, empathetic communication from healthcare providers can significantly improve trust and patient satisfaction, which in turn improves patient outcomes. This approach requires healthcare providers to actively engage with patients about their experiences and perceptions of the care they are receiving, including any concerns about biases or mistreatment. The case of Mr. Thompson is not an isolated incident. It is a glaring example of a widespread issue that affects the quality of healthcare received by racial and ethnic minorities. As healthcare providers and administrators, it is our duty to ensure that our systems do not just perpetuate quality care in theory, but also guarantee it in practice across all demographics. The journey towards clinical equity is not a quick fix, but a continuous commitment to education, system redesign, and honest introspection about our implicit biases and their impacts on patient care. Thank you for your attention. I look forward to discussing these strategies further during our Q&A session.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today we'll be diving into a complex and in-depth discussion on the management of multimorbidity in elderly patients, a critical issue that spans multiple disciplines in healthcare. Multimorbidity, the presence of two or more chronic conditions in a patient, poses unique challenges and necessitates a comprehensive, integrated approach to healthcare. Our discussion will be based on the latest research from Harvard's scholarly articles, focusing on the complexities of managing such cases effectively. Let's begin with a case study that exemplifies these challenges. We have Mr. Thompson, an 82-year-old retired teacher with a history of type 2 diabetes, chronic heart failure, and osteoarthritis. Mr. Thompson's case is particularly challenging because the management of his heart failure and diabetes requires careful balancing to avoid exacerbating either condition. The interplay of these conditions with osteoarthritis complicates his physical activity and pain management strategies. According to recent studies, the management of multimorbidity requires a shift from the traditional single disease framework to a more holistic approach. This involves comprehensive assessment techniques that consider the complexity of having multiple chronic conditions. A paper published in the Harvard Medical Journal outlines a framework for integrated care that emphasizes the use of multidisciplinary teams to create cohesive management plans. In Mr. Thompson's case, his healthcare team includes a general practitioner, a cardiologist, a diabetologist, and a rheumatologist. Coordination among these specialists is paramount to ensure that the treatments for his heart condition do not interfere with his diabetes management and vice versa. For instance, certain diuretics used for heart failure can impact blood sugar levels, necessitating close monitoring and adjustment of his diabetes medications. The role of technology in managing such complex cases cannot be understated. Digital health tools, such as telemedicine and remote monitoring, are invaluable for maintaining continuous care. A recent Harvard study highlighted the benefits of remote patient monitoring systems that track blood pressure, heart rate, and glucose levels in real time. These systems provide a continuous stream of data to healthcare providers, allowing for timely interventions before acute exacerbations occur. Diet and lifestyle modifications are also crucial elements of managing multimorbidity. In Mr. Thompson's situation, a balanced diet tailored to his conditions, low in sodium and balanced for heart health, yet mindful of his blood sugar levels, is essential. Additionally, physical therapy and gentle exercise routines adapted to his limitations due to osteoarthritis are recommended to maintain mobility and reduce pain. Patient education is another critical component. Ensuring that Mr. Thompson understands his conditions, the reasons behind each medication, and the importance of lifestyle choices empowers him to participate actively in his own care. Harvard's research underscores the importance of patient-centered care in improving outcomes in multimorbidity management. This approach fosters better patient engagement and adherence to prescribed treatments. One of the pivotal points from Harvard's studies is the concept of polypharmacy, which is prevalent in the treatment of multimorbidity. It involves the use of multiple medications by a patient, often leading to a higher risk of adverse drug reactions and complex drug interactions. In Mr. Thompson's case, regular medication reviews are necessary to minimize these risks. The goal is to streamline his medications to the essentials that achieve the best balance between efficacy and safety. Lastly, the psychological impact of living with multiple chronic diseases can be significant. Addressing the mental health aspect is essential for holistic care. Depression and anxiety are common among elderly patients with multimorbidity and can diminish their quality of life and complicate disease management. Incorporating mental health support into Mr. Thompson's care plan is not just beneficial, it's crucial. Managing multimorbidity in elderly patients like Mr. Thompson requires an integrated, patient-centered approach that addresses medical, physical, and psychological needs. This involves not only a constellation of healthcare professionals, but also the adoption of advanced technology and thorough patient education. The challenge is significant, but with the right strategies based on cutting-edge research, we can improve outcomes and enhance the quality of life for these patients. Thank you for your attention.